Finally, this plan includes structural reforms to reduce the cost of health care in programs like Medicare and Medicaid. Keep in mind, we've already included a number of reforms in the health care law, which will go a long way towards controlling these costs, but we're going to have to do a little more. This plan reduces wasteful subsidies and erroneous payments while changing some incentives that often lead to excessive health care costs. It makes prescriptions more affordable through faster approval of generic drugs. We'll work with governors to make Medicaid more efficient and more accountable, and we'll change the way we pay for health care. Instead of just paying for procedures, providers will be paid more when they improve results, and such steps will save money and improve care. These changes are phased in slowly to strengthen Medicare and Medicaid over time. Because while we do need to reduce health care costs, I'm not going to allow that to be an excuse for turning Medicare into a voucher program that leaves seniors at the mercy of the insurance industry. And I'm not going to stand for balancing the budget by denying or reducing health care for poor children or those with disabilities. So we will reform Medicare and Medicaid, but we will not abandon the fundamental commitment that this country has kept for generations. Both parties agree that we need to reduce the deficit by the same amount, by $4 trillion. So what choices are we going to make to reach that goal? Either we ask the wealthiest Americans to pay their fair share in taxes, or we're going to have to ask seniors to pay more for Medicare. We can't afford to do both. Either we gut education and medical research, or we've got to reform the tax code so that most profitable corporations have to give up tax loopholes that other companies don't get. We can't afford to do both. This is not class warfare. It's math.